Hip replacement in the United States is approximately $40,000. In Thailand, it's approximately $12,500. And in India, it's the cheapest actually for this procedure, around $12,000. And now the difference between that from the $40,000, around $12,000, that's like a difference of $28,000. You know what $28,000 can do for you? It can buy over 20 acres of land in Uganda, and then approximately it can also help you buy a decent commercial building in Nairobi, just like that, to enjoy it. That's an approximation of how this can be. And so that all you have just done it maybe to save on what like you were supposed to pay or to spend onto the health care costs that we're supposed to incur at that point. So in this video now we should expect, I'm going to define what medical tourism is, who is it for, what are its pros and cons, and then finally I'll give my final verdict on this topic and what so far have learned about this. So you could be asking yourself, who is this guy? Who are you to tell me about medical tourism, healthcare costs, and everything like that? Yeah, I'm Yaledi, a medical student, and I'm in my final year, 5th year, and then just undergraduate, not probably a specialist or the thing. Yeah, so on this channel I share about healthcare costs, healthcare expenses, so as maybe instead of spending loads of money, giving it to the doctor and whatever, you can probably use the same amount of money to do several other things, make investments and make properties just like that, because we are growing, or we are living in a situation whereby medical expenses are a number one cause of bankruptcy and family disputes in many countries, not only where I live or where I be, that's Africa and whatever you get. I have a personal story that probably many families are experiencing something similar to that. I had my grandfather who was, I trusted him, I believed in him, and everything he does was really smart. But now for this move that probably they were not so aware about, maybe they had no plan for their health, expenses and what. So in his 80s, he was diagnosed with prostate cancer, which started as a benign condition. Benign condition, we say at times it's just like something not so much that if at all they just remove the prostate and what, you actually get better and you do better, you don't even incur extra costs into this. But now it reached an extent that all those symptoms were showing for the benign conditions, and it reached when it was now a cancer, so there was nothing that could be done, and it had progress, from the different stages. It goes stage 1, stage 2, stage 3, and now it was in stage 4, whereby at that point there was nothing much to be done for him, apart from the palliative care. So it was under palliative management, and they tried to manage him several ways, and people were, his family he had a huge family, he had a number of children, and then the wives, around three wives, just like that, and then he was into that process. So they were trying to pay for him, his children were supporting him and whatever, even incurring his own assets, selling part of his assets to clear up the medical bills that were into it, of course with an intent that maybe he shouldn't die from home and just like that. So but it reached a moment when we had nothing to do. Actually we had to, medical expenses had gone high, and assets had been ruined. Everything that he had made in his 80 years, and the plans, everything that he had made was just ruined within just these few years of sickness, just like that. And to us it affected actually the entire family, to an extent that the entire family now was split, because anything regarding finance and then care and something like that, at times it's a number one cause of family disputes and what. So from nowhere, everyone that had contributed, they were feeling they wanted that had contributed too much, they were overwhelmed and what. So from in the end the family was split into 3. You get those that really felt like they're opposing, or that they want to do contrary to what their father decided to do, and those that were in support of that, what my grandfather actually was aiming at, and then those that were just neutral. So in the end 3 groups were formed out of one family, and such a family can't remain the same anymore. So the meetings that you have, maybe family meetings and what, everything's just disputed, and everyone is just on their own. That's how I could say it. So that really pushed me into that topic. Of course then I hadn't joined medical school, and I hadn't seen the challenges that people really go through, so I thought that maybe it could be something that everyone experiences, and okay, maybe it's the norm. Yet I realized something can be done about it. So I tried to venture and learn about healthcare costs, how to manage healthcare expenses and healthcare finances, just like that. Yeah, so let's start now. Let's go back to the video. That was just a brief, introduction or something about me, and why I really love sharing about this topic. And so medical tourism, I would define it as a global healthcare market where people travel from one country and then go to another country to just seek healthcare needs that they really need, probably when those things are not provided in their countries. Say now if you're staying in Africa or you're staying in let me say some parts of Asia, you get some services, healthcare services are not really there. So for example, the complex cardiac surgeries and hip replacements, certain specific dental procedures and dental surgeries and what you get. So they're not really available where you may be staying. So that forces you, or there is need for you to travel to another country. So that's one of the reasons. And then the other reasons are maybe when the cost, and that's the main purpose as to why I had to record this video. It's the cost, and the cost is probably there's a higher expense on whatever you're paying, yet there's just as I was giving the example of the US hip replacement, which is 40,000, and then India's, which is approximately 12,000. So you can see that big difference. And I gave you, it can buy lots of things, not only maybe the countries that I started with, Uganda and then Kenya and Nairobi. You get other places you can use that money more profitably instead of spending it all onto healthcare expenses just to get the same services that you could get somewhere else at a cheaper cost. And then by that, guys, I've checked onto my analysis, and then I've checked that most of you guys that watch my videos don't really subscribe. You get about 63.3% haven't subscribed, but you guys are watching my videos, and only 37.3% have really subscribed. So guys, call upon you, please do me a favor, tap on the subscription button, and then turn on the notification bell, so as you don't miss out on the next videos. The next video actually will be about I will explore the hidden costs of medical tourism, and because it's a good thing, but at least you have to know the other bad side of it to get, because it has its own pros and cons. As we shall look at it, the advantages and the hidden things that you may end. At times people just go into the process and then they end up spending much more than even what they could spend at home. So please subscribe. All right, thank you for subscribing. And then, so who is eligible for medical tourism? Anyone that wants cheaper or save more onto healthcare costs. That one you have 100% reasons as to why you should think about medical tours and what you get. And then if you are not insured, in the US you have almost, let me say, around 80% of people are under insurance. But this side of the world where we stay, it's the reverse. Around 20% are under insurance. Actually, that one might be even too much. Let me say around 10% are under insurance. So most of us are not insured. You get. So by that, we have many reasons as to why we could embrace the medical tourism, just in case we have maybe a condition that we really want to manage, probably cosmetics, dental things and what. You can go and do some replacements on your body just like that. So what are the pros and cons of medical tourism? The advantages, those are the pros that I'll start with. There's massive cost saving. That one, guys, I don't know how I can explore this, but the cost saving is massive, completely like that. And then you can get, in most cases, there's world-class healthcare management. Some people are really worried that probably since now these services are cheaper, so even the quality is less. I would assure you that this one is at an international level, world-class level of quality and care. So it's managed under the Joint Commission International. You get. So this one is like a measure or a program that was put in to regulate all these hospitals such that they are put into world-class, standard care. You get, so that they can be the services, actually the same services that you will be able to receive maybe in the US, in the UK, you can get them in India, and the same doctors, they give big quality doctors everywhere. So these are the doctors, you may find that the same doctor that would have worked on you in the US, the one that you find in India. So you shouldn't be worried about this one. So, and then the other thing is privacy and then discretion. When you want probably maybe some private life, or you're a celebrity like me, you get sorry, but if you're a celebrity or you want some form of privacy, not so you can decide to go and do something out of your home, you get. And this one is more practical with the medical tours. And then when you don't want to follow up the long lines, This one is so evident, and where you have universal healthcare systems, you get where things are not private. You have to wait long hours. Maybe this one is high. UK, it's just almost everywhere. As in Africa, most of the countries actually, we have this, and it's overwhelming, guys. It's really overwhelming. Waiting, along the line to see a doctor, and then you reach there, the doctor gives you 1 minute or 2 minutes, hasn't listened to you because probably they have a longer line, following them. So the quality, even the time and your own satisfaction is really missing. So you feel like you haven't been helped out. And then those are the advantages I could outline about this. And then what are the cons and all the disadvantages? Disadvantages here, I'll give the disadvantage and then what the other options that you have, or the solution to that. So the disadvantage one is our follow-up care. And who handles your follow-up when you're back home? That's our biggest worry that everyone really experiences. But this one has a solution. Follow-up care now have the telemedicine thing. Telemedicine helps you. You just, of course, every hospital on discharge they give you the how you follow up. They give you a doctor that's concerned and everything. So if you want to return back home, you can easily connect up with the doctor via telemedicine, and then follow-up will be easier. At times they just make, you can just plan for a longer stay you get. So if you're deciding maybe you're running from the US and then you're going to India, you can plan for a longer stay, say a month, just like that, so that you can, really enjoy the process, and then you heal, you heal probably at the beaches around India, and then, enjoy India's nature, so that by the time you come back, you're already well mentally and then physically in your body. So you're good, you have recovered so much well. And then the other disadvantages are travel costs and then the risks you get. Sometimes maybe you need to even transport the person that will be as probably the immediate or the next of kin or your caretaker, something like that. Of course, it's highly recommended, because despite saying that maybe there is high level of care and what around these hospitals, but you really need someone who can give you the support. Of course, nurses and doctors really won't give you the adequate support as your own person or your own friend, a relative, your spouse will give you. So you really need to transport this as person, get a visa for them and everything, just like that. Sometimes it's quite difficult, but when you follow up through the specific organizations, and then medical tours have their own specific companies that can help you out all these things. So you just have to search a little bit, just as you landed on this video, so you land on those companies or that will help you, your journey will be made smooth, just like that. And then the other con is a difficult legal recourse. You can't literally sue a hospital that's abroad, easily, just like you can sue a hospital that's home. Just in case of any, maybe complications or something that were not really explained to you very well that was done, and then you feel like you need to throw up a complaint to the court of law. But of course, something maybe laws are different. You may be from the US or from the UK, but that now you can't, it's not easy to sue a hospital or a doctor in India. Since now the laws are relatively different, unless you take time to study the laws and what, and that's all a complex thing. So that's one of the pros. And then the quality variances, this one has been addressed virtually, because it's also a con at times, because the differences in the quality of care. You may find that if at all you haven't taken your time to research about who your doctor will be, where you're going to seek this care and whatever, you may end up learning onto scammers. I could use that word, but not literally scammers, but people who don't really give you the quality that you really deserve. But this one now, it has been addressed by the Joint Commission International. That one also just helps you confirm, and then if you use that and you pass via that, then everything will literally be smooth for you, I could say. So a conclusion now, guys, would you travel to India and then save on that amount of money, the $28, just do a hip replacement, or just even doing any procedure that you wish, or you would rather prefer stay home and maybe in the US and then you pay that amount of money you get? So please drop your comments, and then I try to know what you guys think. And I'll say medical tourism isn't about just maybe reducing healthcare costs. Actually, it's a tough decision that should make consciously, you get, because it has, as you have seen, it has its pros and cons. Not everyone really needs it, and at times it's not so necessary to travel from the US, from wherever are your home country, and then you're going maybe somewhere else to seek care just because you want to cut on costs. You have to analyze your personal condition and what you benefit from that side. If at all the advantages outweigh the disadvantages, then probably you need to move. But if at all you are in a state that, you know, the advantages for your side, if you lay out, and then the less than the disadvantages, you see the cons are more, then you should just consider, you know, receiving care from your home country.